You're welcome back. We have in the studio to my immediate left, Dr. Alhaji Alhassan Zakaria. He's General Medical Practitioner and Medical Director of ZAC Medical and Diagnostic Center here in Accra. Sir, you're welcome.
Thank you.
And next to him, we have Mr. Edem Kauba Hene. He's Vice President of Ghana HIV/AIDS Network, GHANET, and has over 15 years of experience working in Ghana, Uganda, and other countries on this subject. Sir, you're welcome.
Thank you very much.
Doc, I'll start with you because you have an interface daily with patients. How serious is the menace of HIV/AIDS to the Accra metropolis and the Republic of Ghana generally?
Yeah. Thank you very much. Good evening to you and the listeners. In your earlier introduction, I heard you say shocking news. It's shocking to the general public, but it's not shocking to the clinical environment. We see the cases daily, and without any serious research, you can see the jump in the number of patients with such cases. Daily, apart from the antenatal cases that is compulsory, you can run HIV tests on them.
Yes, sir.
Occasionally, when you have cases that you suspect,
Yes,
you
sir.
could treat a condition 2-3 times, and the person is coming back with less improvement.
Yes,
When you click on positive, and it's too strange. I'm sure it's related to lack of information now, which should have been. These days we have internet, we have more TV outlets, radio.
Yes,
So it should rather be the opposite. Yes, we've rather seen an increase. So I'm sure there is a problem somewhere. Years back, we had only a few media outlets.
Yes, sir.
Yeah, and almost everybody on daily basis is reminded about the danger of HIV, stigmatization, all issues about HIV. The story now with more media outlets is different. You rather hear other things on the airwaves than to hear both the Ministry of Health, Ghana Health Service discussing issues on HIV.
Okay, we'll come back because the issue of the media and the glorification of sex, unprotected sex, and aphrodisiac, those are quite causes for concern. But Mr. Kauba Hene, can you quantify the menace we are contending with? What is Ghana up against? What are the numbers, so to speak, of those who have been infected with HIV/AIDS?
All right. Thank you very much. Let me say good evening to all the viewers on the channel. The fact is that initially when you, in your introduction, you mentioned 21%, but that is not the figure. The figure is 2.1% of the population of Ghana that is infected with HIV. Yes. In 2016, the prevalence was 2.4, and this 2017, it has reduced to 2.1%. So we have actually seen a reduction. But from 2014, 2015, 2016, it rose up, or it increased rather. But fortunately for us, it has come down this year. So now the issue is that people living with HIV are all over the country. There is no exception. From Greater Accra all the way to the north, every part of the country, people living with HIV are all over the place. And the prevalence, although has come down this year, when you come down to regional basis and you come down to site basis, you realize that the prevalence is rising rather. Although nationally the prevalence is down 2.1, but if you come to the subpopulations, we have MSMs, that is men who have sex with men. In that population, the prevalence is rising. In the female sex workers, that population is rising. In the general population, the prevalence is rising. But if you put down the national figure, you put it all together, the prevalence is reduced to 2.1. So that is the figures for you.
That's an interesting point. Men sleeping with men.
Yes.
That is the most exponential of all.
That's another issue we have to talk about.
Yeah, the issue of homosexuality has gained, currency within the public space. Doc, has there been any time that you've tested any patient who admitted to you he was a homosexual and you found out that the person had AIDS, or you've never crossed paths with anybody like that?
Yeah, even if they do, you may not be sure he's getting it from that activity. Some of them they are normal heterosexuals, and either they are the wives in the homosexual industry.
Okay.
Yeah, so you may not be too sure where the infection is coming from.
Okay.
Yeah, but like you said, Greater Accra is the capital.
Okay.
In fact, the two regions with the highest population, the prevalence is on the rise.
Okay.
And that's the most disturbing news, because these are the places where people come in daily and go back.
Okay.
So it is very easy to spread to the other parts of the country, because almost every region or district in the country, people visit the capital and the second biggest city, that's Ashanti region, Kumasi.
Yes, sir.
It's normal to find people indigenous of these two regions not knowing too much of other regions. Okay. It's almost impossible for any other regional not to know these two regions. So once we have prevalence in these two regions very high, we are in trouble.
So it's more about population, how many people converge. Or you can say Tadi, an oil city, has a scary rate of HIV/AIDS because of the influx of expats. Or that is not a valid argument.
It could be, but it's still far below these two populous regions.
Okay. Mr. Kawuhine, you wanted to say something about Takoradi and other areas with an influx of expats.
Okay. I'll prefer you call me Edem.
Okay, Edem.
I like Edem. The fact is that with Western region, currently Western region is the third on the list. Okay. You come to Ashanti region is leading by 3.2%. Greater Accra is also 3.2%. Then Western region is 2.4%. Volta region 2.3%, and it goes all the way down to Northern region is 0.6%. Now, there are a lot of factors that influences the prevalence rise. You are talking about the OSCT. Before, Western region was just low down the belt, but because of the factors that there are a lot of influx of people into the Western region, not just expatriates, but people, a lot of people, there's a lot of business going on. People flock there to do business, traders, businessmen, then all those in the oil sector as well. Definitely, once there are a lot of people at a particular spot, the sexual activities goes on. You know, people bargain, people have sex, people have it for fun, people have it for money, people use it for pleasure and all that. So normally, the mode of transmission in HIV, we said heterosexual sex accounts for about 80% of HIV transmission. There are other factors that also transmit HIV, but that is just minimal. But sex is the majority. So once people are interacting and sex goes on, definitely the prevalence will rise. So if you look at the sites that the test or the screening was done, you realize that the urban areas, the prevalence was higher than the rural areas. And even when you come to the urban areas, you have some big towns and business centers or market centers, you realize the prevalence are higher than where there are no big, less population, or there's no big economic activity going on. Okay. So those are factors that influence HIV transmission.
Dr. Zakaria, how much of a psychological effort have you made to look at the stigma associated with HIV/AIDS? And of course, there is an admission around this table that it's not only through sex. Yeah. What are the other modes, and how do you treat stigma?
With the modes of transmission, like you said earlier, 90%, about 80% is from sex. Yeah. So even though there are other causes, the principal cause, especially in Ghana, has to do with the sexual lifestyle. Yeah, other causes, like you said, blood transfusion, and these days with advanced technology, you have almost non-existence getting HIV from blood transfusion because of the processes the blood goes through.
Yes, sir.
Yeah, people sharing needles. It's still happening among addicts in a very minimal. Yes. You can't find in a hospital establishment using one syringe to inject more than one person. It's almost not existing. So they are documented sources of HIV, but the principal source as far as Ghana is concerned, I think is from...
I'll push you a little bit on sexuality, but before then, we go for haircuts.
Yes.
Does going to a barber shop expose one to such an infection?
Yeah, but it's negligible. Yeah, there are other infections you can be worried about, dandruff and the like. But to get HIV, normal haircuts that were happening now in the shops, hardly do you experience any cuts, because the nature of the machine,
yes, sir,
is almost impossible for you to get a cut. So these are areas that we should not be looking at. We should concentrate on how to have this safe sex and let the information flow. People should know, because there's no information now.
How?
The youngsters fear pregnancy even more than HIV. So condom is of no use. It only comes into play when people want to avoid getting pregnant. Nobody thinks about infection. The infection that is common for them to fear is the UTIs, the PIDs, which you can just get medication for 3, 4, 5 days and you're okay. Yeah, they don't think about HIV because we don't talk about it. And things are worse because the sexual activeness has dropped significantly. Years back, people start menarche last. When you start your menses, people start 18, 20 years. Yes, so 3, 4 years after when you start menses, you naturally will be very active sexually. If you're a woman who starts at 18, by 23, hardly will you remain a virgin. Yeah. Your daughter or granddaughter now is having a menses around 12 years. Add the same 5 years to the 12 years, you'll be getting
17.
6, 17.
Yes.
Yeah, so what prevented you, the grandmother, from staying virgin at 23? Your daughter is going through that 16, 17. Yes. So whether we like it or not, there is so much sexual desire among the population, especially the younger ones. And the culture is broken down. You hardly can correct a child, even your own child. You have problem with your spouse if you want to be too primitive in trying to put the person right. So I think these are the...
No, but then, and Doc, cases come in different shapes and
Yes,
forms.
yes, yes.
You can give a woman a peck and
Yes.
you can have a French kiss,
Yes.
a very passionate
Yes,
one.
yes.
Kissing deep, does it expose people to the virus?
In fact, almost every body contact to some extent exposes you. But the fact too remains that unless there is body fluid transmission, these body fluids, the principal ones is vaginal fluids,
Yes, sir.
semen, that's sperm,
Yeah.
blood, and to some extent breast milk.
Okay.
Yeah. But you can find HIV virus in tears, you can find it in sweat, but they are not enough to cause any infection. These are documented facts where you can find them. But kissing is just with saliva. Unless, of course, you have very sharp teeth that could cause lacerations on the opposite faces. But normal kissing, if even normal sexual intercourse, somebody can have it 2, 3 times without getting HIV, especially when the lubrication is sufficient. The man is on the advantage usually. There are documented cases like that. You are living with an HIV positive wife, and after some time, the man is still negative. And the only explanation that is available is that usually the foreplay prolongs and the woman is significantly wet enough to reduce the friction. It's the friction that causes microabrasions on the skin where these viruses can pass through. Yes, so.
Okay. And there are people from Niger, Adam, from Niger, Mali, and other areas that come with, sharp devices that are not too well sterilized. Is it safe for you to call someone from the street and ask them to do pedicure or manicure for you, not the salon type? Does that also expose people to the infection?
Sure, it does. It does expose
It's more
people.
dangerous than taking a haircut in a barber shop.
Of course. Yeah, exactly. It's more dangerous.
Okay.
But like Doc said, those are very negligible. They are not in the majority. It's hardly you find these people cutting people's fingernails. And normally when you cut the fingernails or do the pedicure, manicure, and there are no cuts, once there are no cuts, you are not at any risk. You understand? So where you cut someone and then there is blood stains, you understand? There's blood stains on the knife or the scissors or whatever the sharp instrument the person is using. and then you use it on the next person, and it casts the person, there's something we call QQR, quality, quantity, and route. So the virus should be in enough quantity to be transmitted, to cause infection. It should be good quality to cause infection, not exposed to air or sunlight or anything. And then there should be a route where there's no abrasion or no sores or no cuts. So if there's no sore, no cuts on my hand, and I dip my hand into an HIV-infected blood, my hand comes out, I wash my hand, there's no infection because there's no route for the virus to pass through. You understand? That is why we're saying if there are abrasions, there are cuts, then the virus can pass through.
And the most painful of all is when an innocent child is born to either parents with HIV/AIDS.
Yes.
So in a situation like that, how do you work on stigma and stereotype against such people?
Okay. The stigma is a very broad topic we have to talk about, but let me start from this way. There's what we call PMTCT, Prevention of Mother to Child Transmission of HIV. Once you are pregnant and you go to the hospital, there is an offer for you. There's HIV test. If you agree to do the test, they take you through the test. Once you test positive, you are putting on treatment. We have now there's a policy on test and start or test and treat. So if you test positive, you start the treatment immediately. So a pregnant woman would go through the pregnancy, go through labor, delivery, breastfeeding and all that, but the child will not be infected. Once you follow the protocols, the child will not be infected. But if you don't test and you don't know your status, obviously you ignorantly pass it on to the child. Now, if you pass it on to the child and it's detected early, the child is put on treatment from that early state. And then it will not have any serious effect on the child, either the child dying or the child will grow normally because the child is going through treatment. So he will grow normally and then live strong and healthy. Okay. Now, when it comes to the issue of stigma, I give birth to a baby. Who knows my baby is positive? Who knows me, my status? Nobody knows my status unless I tell you. You understand? So if the family or friends or any other person gets to know that I am HIV positive, and then they go around telling others, that is where the stigma starts. Okay. Sometimes it starts immediately from the family or from the home. My mother is aware, my sister is aware, so they don't want to come near me. They are afraid of me. When I want to do something, they say, no, don't do this. They don't want to come eat with me. They don't want to share anything with me because they think I'm HIV positive and I'll pass it on to them. But let me say, surprisingly or fortunately, HIV doesn't live in food, water, or plates, or hands, or those things. So I've been doing this work for so many years. I meet people living with HIV. I work with them. I eat with them. I sleep with them. I play with them. We hug. We keep. We do so many things together. You understand? So HIV doesn't live in their hands, so that when you shake my hands, you get HIV. So once this education goes on and people are aware of this, stigma will be reduced or will be eliminated. So we need to do more education. And that is another area we have to talk about. We need to do more education to make sure that people know the modes of transmission and the modes of prevention so that stigma will be reduced. But once I am infected, I can live strong and healthy. You don't need to discriminate against me. I can work, I am strong, just as you. Both of us, or the three of us sitting here, is it written on anybody's forehead that is positive? You can never know unless I tell you. And there's a law right now in Ghana. If I tell you that I am positive, and you go tell somebody, and then I get to know that you told him, and then it spreads, and then the stigma starts, I can sue you. There are laws that protect me from being stigmatized or discriminated against.
Okay.
And that is very good for us.
Dr. Zakaria, your work has taken you to hinterlands, various districts. You've made a point that suburban infections are higher than rural ones. How about traditional practices like female genital mutilation and the usual circumcision that is not done in hospitals? Do these traditional practices also expose people to HIV infection?
Of course it does. It's well documented they do. But like you said, the quality of the virus on the instrument, the quantity, these two should not be compromised. Before the contact, when the route is, there is clear route of transmission. So, though they are documented sources, funny enough, the three regions where you have most of these practices consistently are having lower prevalence. So in as much as they are possible sources, personally I think we should not see that too much, because if you go to the northern region, upper east region, upper west region, when we're talking of FGM, female genital mutilations, one-zam circumcisions, they are done there more than they are done in the urban areas. Yet the story there is different when it comes to prevalence. So there is something, we don't need to go outside to learn. The fact that some part of the country have consistently been getting lower prevalence, even with increased population, that is the best. We just turn our attention to these regions, see what they are doing right, and possibly adopt it for the entire country, which may be difficult because the three northern regions are less civilized. Civilized in the sense that they are still more African than those of us here. You have almost every man, especially in northern region, which has the least, almost every man having two, three wives, which the civilized society will laugh at. You come to the urban places, you have almost every man with a beautiful ring with one wife. Yet when you go to those sites in the night, you know what I'm talking about.
Yes, sir.
You find them there.
Yes, sir.
Because the anatomy and physiology of a man is not designed for one woman.
That is quite controversial,
Yes,
and Doc.
yes.
If you said this in Europe, you would be in trouble.
Yes, yes. You can, on moral grounds, on legal grounds, want to be faithful. But the fact is that we are not being able to be faithful. That's why it is happening. The facts are clear. Why is the prevalence in Ashanti region, Greater Accra, so high? If you are in the clinical, if you are in the consulting room, sometimes you get so worried when you are going home because it's too much. Very young generation, very intelligent people that should come and handle this country tomorrow are just having fun, and you are infected. Nothing can be done about it. Going on ART is good that we have antiretroviral medication, but the volume of medication you need to take daily is like granite. And you have to do this for the rest of your life. How many people can, aside the side effect you're going to go through, even food, it's not easy to eat. Yes, so to me, we should concentrate on the sexuality. We should play safe sex. Initially, when they started ABC, we have abstinence, being faithful, condom use.
Yes.
It is obvious, as far as this prevalence is concerned, being faithful, especially in the urban areas, can't work. It would have helped, but it's not working.
Yes, sir.
So let's concentrate on the condom use. And abstinence, well, can we?
Yes, we can.
When the culture is broken down.
Everything is possible.
Yes, human rights. The children have their rights. After 17 years, the child is in a boarding house. How do you control him? You send a lady from Yendi to Accra to do national service. Nobody is here to control her. She can't even sustain her life.
Yeah.
She'll want to fall on one or two things.
Yeah.
And funny enough, this is a personal observation. The sex workers, funny enough, are not the principal source of the spread of the HIV.
Who are the principal
The normal,
sources?
young, beautiful males and females you see around. In a year, you could have, unintentional, you could have 3 girlfriends. You start a relationship in January. By the end of January, the outings and the pizzas are out and you are on bed. By March, your ex is trying to come back. Her ex is calling back into the relationship. You start to find problem, or you are not able to afford the demands. You break up.
Okay.
You start another relationship.
Yes.
These are the sources of the HIV.
Adam, I think Doc is making quite a strong point that this boils down to promiscuity and sexual indiscipline. How do we tackle this? Do the churches tweak their preaching and the imams to make a man understand that the fact that you have surplus income doesn't mean that you should go behind your wife? Or it's better we go overboard and say you can legitimately become polygynous or polygamous in Ghana so that you declare that Akosi, Amansa, and Fati are all my sexual partners rather than going behind your wife?
See, that issue is also very thorny and is very debatable. Some time ago, when we started the serious campaign on HIV, you realize that we were talking everywhere. I sometimes I take my own TV, my deck, video deck, that Piamon call video deck. I carry it, go to churches, go to mosques, go to schools, go to places, various groups, do more education. We have flyers, we have leaflets, we have posters, we have banners, we have signboards, billboards. Where are they now? No more. Because it reached a point, there was something that I thought, or what seems like complacency. We feel, oh, yatiabre, HIV, you said this so many times, and people say kodiewu, HIV kodiewu, and dikanaku, and all that, and people say, oh, die. So now the issue is that once this education has come down, people tend to forget the impact of HIV. People tend to forget that, oh, HIV is no more serious, it's no more any deadly disease. There is treatment, there's ARV, so even if I get it, I can live. Or even if I die, like somebody said, all die be die, so what is the big deal? So the importance, the seriousness that we need to attach to education, prevention, is no more there. So people take it for granted. So now we want to come back to where we left off. The churches must be involved. The mosques must be involved. The traditional rulers must be involved. Civil society must be involved. Media must be involved. Academia must be involved. Medical, every aspect of our society, we should all be involved. The judiciary, arms of government, and government needs to put in money. Let me tell you one thing. The District Assembly Common Fund, how much is dedicated to HIV? 0.5%. 0.5%. And we are begging, we are calling, we are appealing to government to increase it at least to 2% for HIV. Now, the problem is that when the money gets to the district, it's not even enough for the district assembly to run its own business. So if you go, you said, oh, we are coming for something for HIV programs, you say, you wait, hold on, you wait for us, we'll get to you. And they'll never get to you. So there is no funds. Global Fund gives money. PEPFAR gives money. Other donors gives money. But where is the government or Ghana's counterpart funding? Where is it? It doesn't come. So this is very sad for me to say, but there was money from Global Fund. We were supposed to add Ghana's counterpart funding to do HIV programs. The money didn't come. So the money that Global Fund gave us had to be returned with interest. That saddens me.
Okay. On this sad note, we go for a quick commercial break. When we come back, I'll ask, where is the Ghana AIDS Commission? Stick and stay with us. You're welcome back. We are still discussing the increasing rate of HIV/AIDS infections in the Republic of Ghana. And we are here in the studio with very competent hands. And Dr. Alhaji Alhassan Zakaria. He is a general medical practitioner and medical director of ZAC Medical and Diagnostic Center at Accra Newtown, here in Accra. And he's in the company of Mr. Edem Kawuba Hene. He is the Vice President of Ghana HIV/AIDS Network, GHANET, with over 15 years experience working here and elsewhere on this subject. Doc, before we went on that quick break, I was asking if Edem is complaining about scarcity of funding for outreach and public education. Where is the Ghana AIDS Commission?
Ghana AIDS Commission is actually, they are existing, they are working. But it's obvious they are challenged, just like other related agencies. In fact, from the Ministry of Health, Ghana Health Service, and related partners, they are all challenged. It's obvious they cannot do it on their own. They can't do it alone. Stakeholders like the media, the religious organizations, groups, associations, should also be up and doing. If the media can't, Ghana AIDS Commission cannot afford to pay for airspace, the media can't take it up. Even if it's a minute advert, you remind the public about the prevalence and the dangers associated with HIV, how people should prevent themselves. The churches, like you said, can't crusade that. The mosques, we have groups, subgroups, associations. If you come to a city like Accra, you even have maybe Bullseye Youth Association. Yes, all of these people should be brought on board. Any small groupings should be brought on board. This will go a long way. But what I think we are also not doing well as a nation is that we are not doing well when it comes to the preventive health side. That is not just for the HIV, malaria, the hygiene-related conditions. We are concentrating on their treatment, clinical work. we are struggling to afford antiretroviral medications. Meanwhile, a fraction of that budget that we use for ART can't do so much in the prevention, so that we'll have a generation after some time of low HIV rate. The education is not there. Imagine a woman delivering at home. If she knows she can be, because most of the mother-to-child transmission takes place during the cutting of the cord, from the umbilical cord. Yes, yes. Yeah. And these are information that the traditional birth attendants may not have. And whether we like it or not, it is still going on. And there's a reasonable percentage of our kids being brought to this world through that. You talk to our sisters who carry things around here. When I was at Children's Hospital, they come a lot. Casual discussion. You realize they hardly even go for antenatal. So that policy that the government has, almost every pregnant woman is almost compulsory taken through HIV test. You don't capture those ones. It's only when I come to the clinic that you get me. What if I don't come? Yes, if you move in the night, I can speak about Accra because I'm here. There are communities when you go at this time and see what is going on. Good God.
Would you say sex has been
the indiscipline is too much
and over-glorified?
Yes.
No. It's why don't we tell people it's a 2-minute pleasure and you live with the repercussions
No
for
problem.
the rest of
Go
your
on and
life?
get your pleasure, but play it safe. How much is a condom? Play it safe. When you leave the bed, nothing follows you to your house. They fear pregnancy. If you can do a research today, you realize people go and buy emergency contraceptives from the chemical shops and pharmacies than they go for condoms. You don't use those contraceptives for food. Once you go for them, you have a use for them. And that can only prevent you from pregnancy, even if it's not 100%. The condom will prevent you from both the pregnancy and HIV and other infections.
Okay. Adam, to attract donor funding, you should have credibility and integrity. Would you say that the Ghana AIDS Commission has run dry in terms of attracting donor funding because the AIDS ambassador, Joyce Somensa, came out after so many years of doing advocacy and public outreach that all along she had been living a lie and she didn't have HIV AIDS? Could that have affected the funding needed for outreach for the AIDS Commission?
No, I would say no. Joyce Mensa's issue has nothing to do with Ghana AIDS Commission. Her issue is a different thing. Now, Global Fund has their policies. Other donors have their policies. So if we qualify, if we submit our proposals, if we go through the process, we'll get funding. Generally, globally, funding for HIV and other areas are coming down. So,
is it that we think hepatitis B is deadlier than AIDS, or there are other emerging ailments and maladies that are worse than HIV? That's why the international community is a bit disinterested. Would you say that?
Yeah, like I said, generally funding issues has dropped a little bit.
What accounts for that?
Well, you know about the economic crunch. You know, the difficulty in economic issues right now everywhere, almost not just Ghana, everywhere. So issues of funding have a little bit dropped. But like you said, there are other emerging issues that are coming up. That is one factor. So money that is dedicated for HIV prevention or HIV work is also being diverted, not diverted, but used for other emerging issues. So there's not much funding for HIV. But that doesn't mean Ghana AIDS Commission is dry because of that. You know, Ghana AIDS Commission is a supra-ministerial institution, and it's under the office of the president. Ghana AIDS Commission is directly under the office of the president. The president is the how do you call it? Okay, the president is the head of the Ghana AIDS Commission. Then we have other partners and other stakeholders. So if the government of Ghana is not giving funding to GAC, you understand? Definitely GAC will run dry. GAC doesn't depend solely on donor funding. Although they depend on funding from donors, the Global Fund, World Bank, and other donors, PEPFAR or USAID and others, but not solely. So government of Ghana is also supposed to support. So if the money is not coming, the funds are not coming, definitely GAC cannot do what they are supposed to do. GAC is not an implementing agency. It's a governing board, you understand? Monitoring, assessing, coordinating HIV activities in the whole country. So they work with the ministries of health, Ministry of Finance, and other institutions as well. Okay. So it's not because of Joyce's issue, that's why GAC is dry.
On stereotype, you made a point that spreading the word that person X or Y has HIV/AIDS is, you know, you can prosecute people for doing that.
Yes.
How about knowing clearly that person A or person B lied in bed with me and it is he or she who has contracted me with the disease? Can I take you to court for that?
Definitely. That's willful transmission. You can be prosecuted for that. But you need to prove that I am HIV positive. And how do you prove? Unless you test. You understand? So you have to go through a process. Because if you get to the court, you know the court deals with evidence. So what is the evidence that I infected you? What shows? So you need to prove that I infected you. And once it's proving that I infected you, I can be prosecuted easily.
Okay. And Doc, I'll ask you this question, Doc. The media, you mentioned the media. Yes. Media content is regulated by the National Media Commission. And the proliferation of telenovelas and romance talk shows that are shown prime time, 7:30 p.m., when kids are still awake. Would you call for passing legislation? And not long ago, some TV stations were actually showing graphic footage of sexual encounters. What has happened to our morality? And would you advocate for passing legislation to clamp down on media content that promotes, you know, heightened sexuality?
Obviously, yes. But the challenge will be that the advert alone it's not an end to itself. The taste for it makes people to call for it. The advert goes on. There are people who sit up at night to wait for that time because they have appetite for it. There are others who are not interested. So it is a progression that seems difficult to reverse. Instead of, or alongside the laws, I think parents will have to do a lot. We have to do a lot. We have to, I watch on the sister station, I think TV3, trying to meet people in ghettos regarding this abuse of tramadol. Yes, yes. Naturally, these are group of people whose judgment is compromised after they take those things. When they are going for sex, condom will not be relevant because they are not in their right minds. So alongside this issue of educating people to avoid tramadol intake and abuse of other drugs, it should go along with education on HIV. There are populations that sex is almost normal. They should be targeted. They are part of us. You can't stop it. You can't prevent it. People are aggressively going, I don't know how to put it. You know what I'm talking about. We can't reverse it. The best is, look, make sure you are protected. Male condom, female condom, these are the best.
Condom use, is it 100% safe? Is it watertight, or there is a margin of error?
The only margin of error is when it bursts. And if you are conversant with the wearing process, which comes to during the education, if you know how to put it on right, the chances that it would, and you make sure the woman is wet enough, the chances that it will burst is almost, yes, minimal. It's negligible. Okay,
we are discussing the increasing spate of HIV infections in Ghana. You may join the conversation now via phone. You can call us on 0302 904 768. That number will shortly be displayed onto your set. Adam, still on the media. Okay, my director says I should go for a quick commercial break. When I come back, we take a few calls. You're welcome back. Thanks for staying with us. We are still in the studio with Dr. Alhaji Alhassan Zakaria. He's a medical practitioner and also medical director for ZAC Medical and Diagnostic Center at Accra Newtown here in Accra. And then Mr. Edem Kawuba Hene. He's Vice President of Ghana HIV/AIDS Network and has over 15 years experience discussing this subject. You may call in to make your contribution or ask a question. And the number to call us on is 0302 904 768. Hello, your name and where you calling from? Hello? Hello? Yeah, your name and where you calling from. You can put off your TV set completely or lower the volume on it and we can hear you. Okay, please call back again. You aren't too audible. And so the number will be displayed on your screen shortly is 0302 904 768. And someone sent us it. Hello, your name and where you calling from?
Hello, this is Lesson calling from Afua in Ghana.
Okay, welcome to the show and speak up a bit, bro.
All right.
Go ahead.
Good evening, Albert. I really enjoy your show tonight, and I like the contributions that your experts have put across. However, my issue is that, in fact, we try to overlook the nitty-gritties and other issues that leads to the spread of this HIV. You know what? For some time now, we have been battling with this issue of galamsey. I know the youth is this. The more there is money in their pockets, that is what drives them to go for sexual activities. So you see, for some time now, the rate at which the disease is spreading is not. We are not being informed about it. And now that the percentage has come out, let's all reflect our mind back back a few years that the galamsey issue took over the whole nation. You see many dropouts, school-going age, primary school students, DHS school students, and all these people were having 2, 3, 4 girlfriends and boyfriends. So you see, if we allow our youth, especially the teenagers, to engage in this issue of galamsey, there's money on them. Let me tell you, it will spread and spread them more.
Thank you
so
so
my
much.
advice is that as we go on, we should rather do more education, especially to our youth who are entering the SHS and then even to the universities and other tertiary institutions.
Okay, thank you so much for your question. Gentlemen, is that a valid conclusion? Is there a nexus, a correlation between how economically, well a society is and the increasing speed of Scandinavian countries have some of the best social security or social welfare schemes, but we don't see that correlation. Does that bode true that the more surplus income young people have, the higher? Please lump that up with this other caller. Hello, your name and where you calling from? Okay, you're welcome to the show, my brother.
Thank you very much. And we don't have to give your you and for all the viewers. I think you discussed a very nice issue tonight about this HIV. Mostly, I don't know even we will implement a law which will govern these street prostitutes. Because as you said, if we have authorities who giving every single thing a freedom, like if I'm to see about these human rights issues, you can see some people would be doing something on the street. You yourself know that what this people are doing is not good. But authorities allow them because they have their freedom. As your guest said, when you know the place all these people they are, especially when you go to give quarantine programs and this body ability, and no any even single person would tell people that they should move away from what they are doing. And moreover, in this country, something I said in the last 2 months or so about this polygamy. If a country is in Rwanda or the president come out and even apologize to people in his country that if he will, you approve the men in the country to even marry multiple marriage in the country because of this prostitution. So we are told once we are Muslim, you know that I know most of the Muslims are not even in the same set of things, and you know some of our nephews are in this business. But moreover, we have to know very, very much that this thing is not good for the country. So
okay.
we should try.
Thank you so much.
To marry and let the authorities know that this thing is not good in every country. But this thing is even take us a cure.
Thank you so much. Thank you so much. I appreciate it. Gentlemen, take this with one shot. You will tackle the surplus income thing. Traditionally, if a girl had premarital sex some centuries ago, she was banished from the village. And Islamic scriptures even say you should be whipped, you should be lashed 100 times. Can we go back to those?
It's almost impossible. Yeah, but what the first caller said, it's not about the galamsey, but all has to do with some age bracket. Between the age of 17 to 25, if you make some money, the only place you can put the money is to go into this kind of lifestyle. So it's about the galamsey, it's about this caffeine thing that came up, which is still existing. You have some very age brackets, very irresponsible age groups who should be in school making a lot of money. And the only way they can spend the money is to engage in this lifestyle. But all in all, they can go on, but they should protect themselves. Okay. Having 3 girlfriends doesn't make you to have HIV automatically. If you protect yourself, it's about your...
Edie from Tabora says, forget human rights, have punitive measures that are stringent enough to dissuade people from promiscuity and immorality. Would you subscribe to that, Adam?
In this current dispensation, I think it will not work, because Ghana has a treaty with the international community. So you cannot single out yourself and say, I want to respect the human rights, and then go and whip people when they go out and have sex or do something like that. The only thing we can do is to make sure we do a lot of education. Let the youth be informed. Like somebody said, if a youth goes to do galamsey, you know, there are subpopulations and there are driving factors for HIV spread. So if we look at all the subpopulations, we look at the driving factors, the commercial centers, the mining centers, the long distance travel, the truck drivers, the businessmen and women. I mean, there are subpopulations. So when you look at all those factors and we target them, we send interventions, targeted interventions at these various subpopulations, it will help us reduce the spread rather than bringing laws. There are laws, all right, but if we want to do those punitive laws, then we need to consider human rights, because we are not an island on our own. We need to, yeah.
Okay, I think we take 1 or 2 more calls. 0302 904 768. Let's check out a few of the messages. And someone says, hi, Mr. Irbad. There's a caller. Hello, your name and where you calling from?
Hello.
Yeah, hi. Your name and where you calling from, brother?
I'm calling from Botiano.
Botiano in Accra. What's your name? Go ahead. Make your point, bro.
Hello.
Yeah, you can make your point.
I'm getting to you, Mr. Ibrahim.
You must, I respond.
And then my name is Jonathan.
Okay, Joe.
Yes. I'm getting to my ego and then Mr. Lata.
Okay.
It's very important that they are raising up this very issue, because HIV cannot be seen. You can't see HIV moving from one person to another. And so it's very good that they have been funded for us, and then funded for Ghana as well. And they have propagated this issue. And we believe that at least a minister or a government official is watching and shall help us so that we propagate more and reduce the HIV.
Thank you so much, Jonathan, for your call. This message came from somebody. He says, hi, earbuds. It's me, Isaac. I'm always glued to this TV station because of your great interviewing skills. Please, I have 2 questions to ask. First, ask doctor if there are any physical symptoms of HIV/AIDS? Can you look someone in the face and know whether they have AIDS? And secondly, can the stigmatization cause psychological effects on the victim?
Yes. It's obvious there are symptoms.
Sorry, there's another call. I'm sorry. Hello, your name and where you calling from? Yeah, your name and where you calling from? And kindly put off your TV set completely and we can still hear you. Yeah, put off your TV set completely and we can still hear you. Oh, sorry, you may have to call again. Your line is a bit bad. Hello? You are calling from Nigeria? Hello? Oh, sorry about that. We cherish your international audience and try again. Okay.
Yeah, significant weight loss is the principal symptom, but it's not enough to diagnose HIV. Diagnosing HIV, you need to go through a test. You don't look at somebody's outlook because of A or B, you say it's HIV positive.
And during the early days, will the person be emaciated or the
all.
person will be
prompt? In fact, they are different. With HIV, that is the virus. That causes the HIV. That causes the AIDS. AIDS is the condition itself. It's a collection of syndrome. When your immunity is totally compromised because of the HIV infection, then you get AIDS. When people have AIDS, the symptoms are too clear for people to see. But there are other conditions around that present in the same way. So it's not enough to see somebody growing lean, somebody losing weight, running diarrhea, and having rashes to say it's HIV. Of course, in the clinic, there are times as clinicians, we suspect based on the outlook. You run a test and it's negative. Yeah, so it's not enough to...
And would you want to tackle, before I take the next message, would you want to tackle the stigmatization? Can it cause people to be suicidal because society considers them outcasts?
Yes, stigma kills. Seriously, stigma kills. We normally say that HIV doesn't kill, but stigma kills. Because if you live with HIV positively, you will not die. But when you are stigmatized and discriminated and shunned and pointing fingers at you, you start thinking, and it has a lot of psychological effect on you. By the time you realize, either you go mad, or you just die, or you commit suicide. Okay. So stigma is a very serious issue.
Monica from Navrongo says, I salute you, everybody, Ibrahim, and your distinguished panelists, and thanks for your good work. In fact, I thought the prevalence of the rate of HIV is gone down drastically. How come it is still so high in the system? Or is it that the antiretroviral drugs are not getting to the AIDS victims? Or there isn't much education on this deadly disease?
There are two things. She's confusing the two. The prevalence has to do with new cases coming into the system. Giving antiretroviral is to those existing that have been captured and recorded in the facilities. Yeah. So the prevalence has to do with new cases. Nationwide, there is a drop. But when you take the individual regions or subpopulation and look at the prevalence, generally there is an increase everywhere. Yeah.
And this looks like a paragraph from a book. It came from Efuakon in the Amanse Central District. He says, good evening, Irbad. I really love the topic under discussion. Frankly speaking, I'm personally not alarmed about the rate at which HIV is spreading. You know why? The more there is money in the pocket of, I think this was a guy who called.
Yes, yes.
Thank you so much. You made the point on phone. Okay. I think we can take one or two more calls. 0302 904 768. So when all is said, what gets done? Where do we go from here?
Yeah, I think I'll appeal to the media first. Yeah, we all as Ghanaians have social responsibilities. As part of their social responsibility, even if it's a minute, that should be daily, whether it's print, electronic, especially the audio ones. At least it's an advert that will help remind people. But concentrating on money making always, those to spend the money will not be there. Yeah, and to the government, the Galamsey is destroying the environment, but HIV is just destroying the human resource of this country. So if they can apply the same energy they are applying on the Galamsey.
Or do you want them to deploy soldiers to tackle AIDS?
Yeah, well, they'll be dealing with the expert. So the expert will determine the approach to be used.
A task force.
Yes, yes. Not really a task force.
To do outreach and public
yes,
education.
Yes, yes, yes. Like he said earlier, because of the nature of our country, elsewhere the punitive action is working. Anytime they are discussing HIV, no, you don't hear of the North African countries. You don't hear, of course, they have very bad human rights record. But as far as HIV is concerned, it's almost zero.
So in Saudi Arabia, it's not a discussion at all.
It almost doesn't exist. You are going too far. Before the death of the
Gaddafi.
Yes, there was nothing like that in his country. Yeah, so at least let's have pieces of strategies that would save this country. And this human rights thing.
Adam.
Of course, where your rights begin, so end. Somebody's
right begins.
Yes, yes. So it is the right of everybody. It is within your right, human right, to grow and be a responsible citizen. So anything threatening that existence is also against the human right.
Before people get married, would you advise that AIDS is one of the litany of tests, including hepatitis and others? Should you actually take a person you want to marry, your spouse, your potential spouse, to go for the test? And what should be the time interval? Because we are told the person can be negative today, but upon the second test, it comes out that they are positive.
Okay, let me just correct
And this should be your closing remarks.
All right. We don't have AIDS tests. We have HIV tests. HIV test is done in 2 ways. We use the rapid response to do, and then we use the to do the second one. Now, the rapid test is normally done with a finger prick. They prick your fingertips, and then the blood sample comes, is put in on the test kit, and then within 3 to 5 minutes is raised to tell you that you are positive or you are negative. So we don't have AIDS test, we have HIV test. The issue about taking your spouse or your would-be partner to go and test, it is advisable. It is not compulsory and it is not mandatory, but it's advisable that you do that, because if you know the status of your spouse, either you protect yourself from getting infected or you protect your spouse from getting infected. Both of you can live very well. If I am negative and you are positive, we can live very, very well. We can get married, we can give birth to children, the children will be negative.
What are you saying, Doctor?
I am telling you, yes, it's a fact.
You know clearly a woman is positive.
Yeah. Yes.
So you go ahead and marry her.
Yes. Like I told you, I've worked with people with HIV for so many years, and I can tell you, I can't mention names on air because of stigma issues and because of confidentiality issues. I know people, I am working with people, I live with people. The man is positive, the woman is negative. They have given birth, the children are negative. I know people, the woman is positive, the man is negative, they are married, the children are negative. And I know situations, the man is positive, the woman is also equally positive, the children are negative. Yes, so we have concordant couples, we have discordant couples, and it comes with a lot of issues. So we have to, if we should discuss that, we should go into details, but that is not the subject for discussion today.
Maybe for those that are positive and before they go into their bedrooms with infected partners, perhaps you do some prayer before you do that. If not,
prayer doesn't prevent HIV. Prayer doesn't prevent HIV. And witches and wizards don't transmit HIV. Those are myths. They are things that people say, and that's why somebody gets HIV, he goes to the prayer camp and they are fasting and praying and all those things. It doesn't stop HIV. The thing is, know your status. If I should ask those of us in the studio right now, the cameramen, the producers and all of us, how many of us have tested for HIV? Have you done that?
Yeah, I have.
Sure.
Even doctor has tested me.
Exactly.
I can say confidently I am negative.
Exactly.
Doctor can attest.
So the point is, let us all test and know our status. Then in that case, like you said, if you're getting married, it is recommended that you know your status, your partner knows their status.
And doctor, we've completely run out of time. In 30 seconds, your final words.
Yeah, my final words is that HIV is real and it's on the increase. Yes, people who cannot abstain should protect themselves. And like you said, the viral load can drop significantly if you if you are identified early and treatment is started early. The antiretroviral don't cure it completely, but they are too good that to the extent that they can bring the viral load to the minimal
level.
Yes, to the extent that even a test will show negative.
I see.
And these are the stages people get they say they are negative. And even at this stage, if you have a wife who is positive, you can live comfortably without, you can live for the rest of your life with her, you never get the infection.
And Doc, you don't have time. 5 seconds. You are married people.
Yes.
Every 6 months or 1 year, could you go for tests?
Yes, because between the test would show between 3 weeks to 6 months.
Okay, thank you.
So if you are infected, you test within the infection period, you may not get the results.
Thank you so much, gentlemen. We've been discussing.
I just want to thank NACP, National AIDS Control Program, for giving us this. Last week we had the NACON, the National HIV and AIDS Conference, and then NACP gave us some figures. They came out with the prevalence rate. Ghana AIDS Commission, the Ministry of Health, and then CSO, civil society organizations. So let me just say credits to all of them. Ghana HIV and AIDS Network, Coalition of NGOs in Health, and then all the civil society partners. So thank you to all of them, their hard works.
Thank you so much. We've been discussing increasing rates of HIV infections in Ghana, and I was privileged to have had in the studio Dr. Alhaji Alhassan Zakaria, Medical Director of ZACMED in Accra. Thank you, sir, for making time. And then also Mr. Edem Kawuba Hini, Vice President of Ghana HIV/AIDS Network. Thank you so much, sir, for having time. Till we come your way tomorrow with another edition of Time with Irbad Ibrahim. Good night and stay blessed.